I really can't thank you enough for being here. I am doing a ton of work right now. I know people think that now all I do is babies. That's far from the case. You are here to learn about optimal development, right? And with optimal development, everything needs to go into play. If you read books like What to Expect the First Year, number one bestseller in baby thing, they only talk about movement like on page 99. During this stage of birthing, which I do a lot right now, if you're not watching the group Movement Lesson for Parents and Practitioners, every day I put up some kind of a birthing video and so forth. And, the first 3 months are critical to everything we do, from the way I move right now to the way that your child moves and develops. And it's a really misunderstood time. And if you look at what goes on, most of it is to prevent these movements from happening. And so I'm not saying never swaddle your baby, but the way swaddling is done has got to stop, especially when it's equipment-based swaddling, right? And then we go to equipment-based. So now we have things like baby container syndrome. Now we have things like plagiocephaly or flatheads and all these babies. And tummy time really should start right out of the womb. And it shouldn't be a goal. But because we sleep our babies on our back, which is fine, we need to prevent SIDS. We don't do the newborn movement assessment, which every baby should just be doing. And so we don't know where our baby's at in relationship to movement. And so all of a sudden, since we're just exhausted anyway and trying to get, a schedule going and we're just going through the motions kind of thing, all of a sudden, poof, but then I'm getting these texts and videos, as you see, it's 7 months, 8 months old. My baby's not rolling over. Should I be worried? And I'm just like, what? I really barnstormed too after the American government, the CDC, our Center for Disease Control, came out with the whole thing on infant development every 2, 4, 6 months, and they really delayed or took away many milestones. And so I said, that's it. And it was so funny because Graham was like, so you're going against the US government? And I'm like, yeah, Graham, I guess I am. So here we go. Because I'm not here to say do it my way or the highway. What I'm here to say is this is optimal development. If your baby can't do these things, we got a problem. And I shouldn't be hearing things like my baby hates tummy time. My baby can't do tummy time. My baby's stiff. I can't get my baby out of my arms. These are all global warning signs, no matter what country you live in. And it needs to stop. So you being here educates people, educates your life, but please, pass on this information, because there's only one form of tummy time. There's really only one form of rolling over, one form of crawling. And I have professionals out there saying there's 7 types of crawl. Are you out of your mind? That's not the case. So let us get going with that. These are the number one baby myth in preventing optimal development, but actually we're going to have a lot here. There's a lot to learn with this webinar. It's amazing how substantial that you can look at tummy time, and hopefully you'll get that information out of this. As you know, this is my Graham. Graham is an amazing, remarkable human being, as is all our children. And I do have 2 children. I went from there's nothing wrong to he's never going to walk or talk again, kind of spectrum. It wasn't even piecemealed. It was, he's a goner, bottom 1%, mentally retarded, which was a diagnosis back then. He does have an MR diagnosis for the child that's now on the Honor Society collegiate. And, again, not a brag, but it was a lot of hard work. But because of him, because of you, I'm here to eradicate special needs. We are getting too many kids into this system. And worse is, you think there's too many kids into the system. It's that, again, why tummy time is so important, the gap. We're here to fill the gap. I'm about movement awareness. I'm your movement coach. I can't stress enough, if you feel if you're even saying the words like doctor, hospital, go. This is not a time for social media. Is this a seizure? You see this all the time kind of thing. Tell this to your neurologist. Don't even question it to Facebook. Take the film, send it in. That's really the only downside that I really see of social media, myself included. And I really, that's why I am not only a member of my group, I control the group. So does Aaron, but obviously and other people, but I don't mean to take full credit, but I'm for modality wise or a program, I'm the only professional that I know of that's on YouTube, that's on Facebook, that I'm there to answer your questions. I don't see it in any other way, and I just make sure of that. When other comments come in or questions about other things, again, especially if I'm not an expert on and I can't really feel it out, I just won't even let those comments on the group. But if you notice, like CP Awareness has so many people on the group, and it's a great group, but it's parents leading parents. And you do have to watch that, not just for me, but for your child. So what you really need to do is start looking at a lot of your first milestone markers within the first month. You have the absolute horizon. This is the biggest thing that people go, what's an absolute horizon? Really basically is that I have my child and I can put it to the crib, down to the crib, pass it to my partner, pass it to grandma. I have a great video for Erin. I still have to do something on it where she's just literally passing Alice around to all the kids and they just do it. It's just, again, it's a presentation of the spine, where it is in space, where the baby is, and you're going to have that. Baby's lips work around the mother's breast tissue. I can't even begin to tell you how important nursing is, not just for nutrition. And if we could just get all mothers just to give a week to their child, because with breast tissue, we go to our food, we go to corn on the cob, we go to that hamburger, we go to breast tissue. For bottle, it's now the reverse. And so the feeding, the speech, everything takes a complete 180. I'm not saying that because you could never nurse, then forget about it. It's a deal breaker. What I'm trying to say is there's certain movements that are meant to happen. And for whatever reason, then if you don't nurse, this is where you come into play with movement lesson. Has your baby learned how to swallow? Aspiration is, I haven't learned how to swallow. Penetration, I haven't learned how to swallow. That gag reflexes that we call it, I haven't learned how to swallow. That breath swallow ratio comes in real quick, but it's important during this first month. Has the baby learned to eliminate waste? Again, a nurse baby is rotating. The spine now is moving the intestines to help with that, almost like a little washing machine. A bottle-fed baby, you don't get that spine crossing midline. So I believe babies are more constipated bottle-fed, not because, again, the nutrition content changes, is because they're not moving. They're learning to see. Around 3 weeks of age, the eyes start to come into play. They still can't track you, but they'll be suspended with that. And I have a great video on your baby's vision in the first month. It's my highest ranking. I think we've got like 3 million views on it. And they're learning tummy time. Why does your baby need tummy time? Because again, this is your window. You want a window if my child's going to be okay or not? It's tummy time. Tummy time is a really big window. So when tummy time is missed, and it could be because the NICU, it could be because when tummy time is missed, you're already, again, if I go 100 feet and I'm off by a foot, not too much of a deviation in development, but if I'm off by a foot when I'm at 10 feet, by 100 feet, I'm off by 10 feet, that now we have these bigger deviations. So tummy time really, even if you don't do the newborn movement assessment, is a really big key marker. So I'm going to go right into the myths. And myths, we've got a whole bunch of them here. I know there's a number one myth, but here is a big one. And we're going to cover a couple of big number one myths. It's only necessary when your child's awake. No. I know, again, you're not supposed to leave your baby sleeping on their stomach face down, but this is where supervised parenting comes into play. When you're here, a baby during their first hours of birth, they're here to, and you'll see the head almost do like an X, right? And what they're doing here is they can go in and out of sleep, come up, and down, and that is the true tummy time. That's the beginning of tummy time. In 1 minute, a true tummy time by 2-month-old baby, your baby's making 1,800 movements, right? And you can see that on my sensory mat. That video's on YouTube. And if you need me to post it up later today in the group, by all means, ask me to. So you're meant also to, your sinuses or the mucus flow in a baby is very thin. right? Like I look forward, I don't pour, I don't drool. I might, if I'm impaired, but I don't. Drooling is a big sign, but the drooling gets very thin. And so when your child's moving around, this mucus gives a vestibular input into the brain and into the body. And that's also what's very important. So when a child is going backwards and so forth, they can't handle these mucus changes. Myth number 2, tummy time is only done on a flat surface. In reality, you're the best toy ever. This happens right when you give birth. Your baby should be on top of you. Your baby is learning because you weight transfer. Your baby is getting the weight transfer. They're also starting to, they reach with their whole body. The reach milestone is not necessarily with your fingers, right? It's, and they're like little snakes and they go into you like that. Again, these things don't happen when you're swaddling or put it into a device. They are learning their push-pull milestones. This child here, you know what I mean? The development is amazing. Tummy time should be avoided if the baby doesn't like it. In reality, again, this is what I'm talking about. You have to do the newborn movement assessment. If they don't like it, what happened? Because again, they give birth, they come right up onto you. Was it a C-section? Was it the NICU? Was it phototherapy? Was it something like that? Because again, if they don't hit this tummy time or you're avoiding it because you don't want to hear a cry, and I'm not saying they should cry through it. They should, tummy time should just be as natural as being on their back. It should just be one and the same. Tummy time is only necessary until the baby can roll over. Well, if you miss tummy time, the baby's not going to roll over. So where are we going to go? You know what I mean? So tummy time also goes into the pubic bone strike. It goes into airplane. It goes into your Moro reflex. It goes into so many things. A tummy time again should be worked on and introduce day of birth. Tummy time is only for babies without any development concerns. Again, if you want to increase your chances of not having developmental concerns, yeah, they need tummy time. You know, Dr. Oz did this great thing, and I don't know how the body works. Dr. Oz did it with his buddy. I forget his name. I'm sorry, I'm bad with names. And it's like, should I floss all my teeth? And the answer was no. And you're thinking, why is it no to floss your teeth? He goes, only floss the teeth you don't want to fall out. You know what I mean? Like, tummy time, it's not about one milestone. I'm going to say this several times. It's about milestones. But, however, this is also a key area time too, where reflux, colic, and that kind of thing. Please work with your healthcare professional. If your child hates tummy time, most likely there's a medical reason. So again, this is not a newborn baby, but it's pretty darn close. You know, it starts at birth. It does it with the breast crawl. It does all of that. It's really important. And this is like just a bonding. She's not doing per se. Now you could do a little bit less than, but she doesn't have to, but that's important. Okay. Myth number 6. This is now we're going to get in and I'm going to show you more movement. Getting into it's actually good 10 myths and we'll go into myth number 6, core muscle activation. I'm going to just say this outright. Are you kidding me? If you activate a baby's muscles, I don't care if it's visual, fine, gross, you immediately are deviating from weight transfer and transitional skills. So again, this child being propped on the elbows and looking for a head lift. See how you don't see the X's? You're getting more the bob. So already I could see that that's a fall right at the end there. That's what I start looking at. Like, we don't have tummy time. And my people are like, well, my baby's not fussing, right? But that baby right now has what you would know if you watch me enough, heavy head, right? And is not getting the pubic bone area. So at some point it will fatigue out and just drop. And that's not tummy time, right? Even though it's a baby on their tummy, it's a drop. And you'll see it right here. I'm going to do it. Boom. So again, baby needs core movement. This is a fact. A baby needs core movement. I'll move my little headpiece over here. So See, look at this child, the head's floating, you're getting the, all of this kind of thing. The arms are coming up, the legs are coming up. Your baby is already working on those transitional skills in tummy time. People go, well, there's no transitional skills in tummy time. Here's a great example of this, right? And so premature muscle activation limits or cancels this process. Or lack of, so you really have a problem here. And that's, again, these two areas, right here. Oops, it's not letting me. This and this, you can start seeing, CP. Right? And that's what I get too. People go, oh, now this was absolute horizon going into tummy time. Daddy just not drops, but brings the baby to the floor. Right. And it's really, see, look at that. Woohoo. And it's just, that's an absolute horizon. Myth, though, they need upper body strength. Tummy time movements, again, I'm going to say this all the time, weight transfer and transitional skills. They should not be using any kind of strength whatsoever. They just do it. So again, yes, if your child is high strength, hyper responsive, stiff, whichever, or low tone, again, these, do you see the window of opportunity that you have right now to find out if your child is having problems and how you can help them? Babies don't need strength. The tummy time is a first milestone where they learn to oppose gravity. They do this in breath. Their spine needs to breathe, right? We think of breath here. If I say hold my breath, we do this. It's really hard if I ask an adult to breathe away and there's spine and stuff. I should be able to breathe in any direction around my body. And, we are on our backs too much, and it causes a problem. Causes problems even in speech when this is things. So that's an issue. But if you have strength there, then you're not going to get the breath. Now, here's this baby again. They need head control and visual exploration. What day-old baby has head control? Again, you saw that little baby there. He's doing tummy time on mommy's chest just fine. This child has nothing. His tush is up in the air. He's propped underneath them. Someone's tucked his arms. Like, this kid is drowning. And yes, this is where this type of parent will be told their baby is not strong enough. But when they get that kind of advice, they're working on aspects of cerebral palsy. I'm not saying this child has cerebral palsy, but you're making a stiff, uncoordinated baby. This is not optimal development. You can see the heavy head and the head lift going on, and it is just not the way the baby works. Vision starts before head control. Go watch my video on baby's vision first month. Vision is not meant to happen on the first days of life, because they are meant to just experience the absolute horizon and tummy time. That is the key, right? But around 3 weeks of age, the baby's eyes start to work. 2 to 3, 8 to 10 days, they'll start to, but again, 3 weeks, they'll start to where they can actually, I wouldn't say track, but they can go into it, right? Now you can see this child has no head control whatsoever. The vision is way superior to this child right now than the head control. Head control really starts around 6 weeks, where you can hold a baby up in your arms or something like that, and you're getting more of that. But vision comes to play way before that, because that's your vestibular, your spatial orientation, but tummy time starts first. So gross motor and skill development. How is tummy time a gross motor skill? Again, guys, I'm just getting this stuff that's out there. Again, it's meant to strengthen and coordinate the muscles. If you read this, you'll be like, yep. This is what they tell us. This is what they tell us. You know what I mean? And then parents put stuff far away, like this child, like he's just supposed to sit. He's not going to start crawling. You know what I mean? Put it close where he can see. This is a bit too visually complex even. And again, they're looking for muscles. Little old ladies can go to the storage right now without the core strength. Oh, sorry that I had the same video. Gross motor skills happen when they have muscle control, which comes way later. This child can't even hold a ball or something like that, and you don't want them to. You really want, even in the hands, to be able to, and you want them to hold it. That's not development. You want them not to hold it. When someone calls me up and says, my baby's so smart, at 2 months old, they're holding their body, and I'm going, oh my God, we're in trouble. Because again, that they've latched on, but they can't release. So, and that's what you really need with that. Lift and control. Again, this is the same baby from all different angles, but he's just lost in his clothes, and now he's really getting what, and everyone's going to step back saying, again, strong neck, back, shoulders. I'll tell you one thing, and I say this all the time, you and I can lift our head. Whoops. A baby can't. It's pubic bone strike, and that's how the head lift comes into play. This child's pelvis is way too high. This baby is not going to develop just based off of pubic bone activation. That's not happening with this poor child. See, babies don't lift their heads. It all comes from the spine, right? And again, too, by the way, guys, she's not planking, right? She's not supporting the head with the arms. The head floats. She's moving in space, right? But she's not planking. This is when STNR starts coming into play a little bit later, but she really is going in it. Tummy time allows the facial bones to move in space. You can see that, all that, what she's doing here, right? And also it teaches them where the floor is, because they don't have a floor in the fetus, and what gravity is. Gravity is the only non-optional force from birth until the day we die. All these other forces, like her working on these push-pull milestones and stuff, come into play. That's what development is for. But the human body gets to experience it. So again, not through force, but through weight transfer, transitional skills, right? They're not meant to say, they don't have muscle memory at this age. Whatever is your vocab, they don't have it. So the biggest thing that you're looking at here, and by the way, there will be the bonus, we're going into 10, but we're going to go into more of that. The milestone performance. So again, this is the big key right here, skipping gravity milestones. So you come out of the womb, you got your absolute horizon, but you got your tummy time. So you're establishing where gravity is in space at the safest place, at the easiest place, which is tummy time. I'm learning how to oppose gravity in my back. I'm learning how to do it, in tummy time. But when we skip these, or for whatever reason, now we can say NICU, we can say all of this, but if we don't understand and we skip those, now we're skipping the transitional milestones. And now so our milestone performance isn't even taking off, it's declining, right? But when we have gravity-based milestones, from breath to tummy time to a natural birth, those kind of things, then we start, the trajectory takes off, because here we're succumbing to gravity. And this is where we're opposing gravity, right? But again, milestone performance and developmental failures, this is where most therapies go after. And that's where you go into like, oh, they have to get stronger. They have to get, they don't understand the movement performance, right? But milestone experience and developmental success, that's why I had to create movement lesson. That's why I had to do 50,000 hours on the table. That's why I had to do all this stuff. First of all, so you guys don't have to go through it, but for you to understand it as a professional, as a practitioner, and as a parent, and caregiver. So again, a lot of people think it's this. Like in my case with Graham, he went to 13 months. We were walking, we were talking, we had utensils. He went around and went back to here, like a 3-month-old level. He couldn't roll over anymore. So I should have known back then he didn't have a snowball's chance in heck to get back into this without some serious gravitational milestones, because his gravity got ripped from his body, right? And this is where was I that smart when it happened? No. You know what I mean? Everybody thinks, oh, Graham was so lucky because he had me. He didn't have this version of me when he was this. And Erin says the same thing all the time. Like she and I, we're learning every day. We're putting the math and the science behind all this. We're learning every day. You know what I mean? And every day we get better. Every day but our mission's been the same. You can see stuff that I've said about gravity since 12, 13, 14. Not only do I have the largest library of working with the human body on YouTube alone, but I've been at it since 2009. I was actually a professional DJ here that I worked with and had nice successes because his son was at risk for autism at 6. And basically 2 lessons he redirected, and he wasn't in the autistic spectrum anymore. But but he's like, Michelle, I can't describe what you do. You need a video. I was like, okay. So I went out and spent $250 on a camcorder, which my husband didn't really approve of. I look at it like Jack and the Bean Sprouts, that I went out and sold the cow and came back with 3 magic beans. So I created a monster with Movement Lesson due to all of this. And that's where we're at. And here we are. For optimal development, you need these 3 things: weight transfer, transitional movements, and rotational responses. Now, in tummy time, you're not going to see as many rotational responses, but they're there. But for non-optimal development, you have premature muscle activation, bypasses, weight transfer, transitional movements, and rotational. So even when we say muscle activation, we mean this low and high tone. So here are the early signs of muscle issues. Again, straps are too much for proper spinal movements for breathing. Straps are making it impossible for your baby to go into most reflexes, pubic bone strike, head and neck propping concerns, respiratory stresses. Okay. You start going into more devices. You don't know your baby. Okay. You just don't know your baby. And so you're looking for the next milestone. We don't have the foundations. You can't build a house without a foundation. You can't let your baby take off without a foundation. I'm telling you, it's just, you're always going to be chasing your tail. I don't care if you want a professional football player or you're just looking for a child not to be delayed. You have to go through, or your baby has to go through the ropes of movement. So we're going to have one more bonus. So again, are you working on a milestone of tummy time or development, which is milestones? So tummy time is the base for milestones, right? So you're not just here for one, you're here for all. And so, like I said, and so you'll see that again, when people later have the concerns and want to go backwards, right? Then they want the next best thing. They want that one milestone. So, and that's where the problem is. So again, you're here to work on optimal development. You're here for the whole picture. You're here for tummy time and everything. You're here to understand development. Again, whether you're a professional or you're a caregiver, parent, it doesn't matter. That's what you're here for. Because remember, we thought that development was just, it's a requirement. It shouldn't be a goal, and it shouldn't be a worry. It shouldn't be a concern. So if you're here, you're in that realm of either how can I help, what can I do, that concerns. But we're here to jumpstart your development, because again, my son walked. So it just didn't even question me like he's going to walk again. But I didn't know it was going to take years. Like I didn't know I probably wasn't going to get walking again. And honestly, guys, if I'd stayed in conventional, I wouldn't have it. I just wouldn't have it many times. And those are the success stories that you see with people, is when they've gone outside the box. I'm sorry to say so, but it's just what it is. So the newborn movement assessment, I do make it free for everybody. I really do. But you're assessing your child. But again, Erin's been supplementing it now with all the stuff that she's been doing with her kids, especially when they've been in trouble, how to go back. With the older kids, probably the newborn movement assessment is the worst thing I ever did was name it newborn, because people, when they have a 3-day-old, they go, I don't have a newborn anymore. I can do this on a grandmother. It should just be the optimal movement assessment. But again, the book was written back in 2016. And again, now we have the breathing. If your child had any respiratory distress during their first 3 months of life, I can guarantee you that without some kind of intervention, your child's going to have problems with vertical milestone. Why? Because if they can't oppose gravity and breath, they're not going to oppose it in walking. Right? Breathing is the easiest thing to oppose gravity in. Way easier than walking down the hallway. And your child needs this. This was my first course I put to bed really for videos, because I thought COVID was going to take us out. So again, we put values on them. To me, they're invaluable. I mean, again, this is stuff why didn't I have? Especially when my son going into chronic respiratory distress. So then we have the tummy time course. Tummy time course is there for you to kick off your development. It's what you need. You know what I mean? You have to understand the milestones. I teach a lot about the milestones and segment trainings, and I do all of that, but at the same time too, they need this, you need this. But most of all, what you really need is a baby support program, because first 30 days are free, and then it's $20 a month afterwards, but you get live Q&As with the Zooms like you're getting here, but you're getting also every course that goes into infant development. So you don't have to pick and choose. You can go and do what's necessary for your child. And that's a great thing about it. It's not that every baby's unique. When development happens like it's supposed to, like the way I say it's supposed to happen, then babies are all the same. When babies start becoming unique, I'd worry. When you're being told, oh, don't worry, babies happen, we got a problem. And that's what people don't realize. So altogether, this is what you're getting. It's huge. It's everything you need, in your child's development. And you always have the Facebook group with us. But again, you don't have to pay that much. Right now, it's $25 to get into all of this and to start the support program. And you know what I mean? Like, it's just a baby essential. It's just, it takes the worry out of parenting. It's just, you shouldn't be. So again, if you feel that you have any of the stresses that I gave you or showed you, that's what you want to avoid. With all of my stuff, there's a money back guarantee. There's never a problem with that. But we're here to redirect your child's optimal development. That's what we're here for. So Erin's going to put this link in the chat, and so you can see that. But now, what if my child's older and missed tummy time? So this is really important, because again, that's what I get. Well, my child's 15, so what? I can tell you right now, if you want to improve their soccer and all of this, you still could go back and improve just the way that they are on the floor. And if you don't believe me, go watch a surfer. You know what I mean? Go watch a gymnast. Go watch any person that is in master levels. They didn't see, this is what I don't understand about reflexes. They're meant to integrate. You want those reflexes going on for the rest of your life. But what they look at it wrong, like Moro is not a startle reflex, but they say it's a startle reflex. It is when it hasn't done what it needs to do. But at the same time too, Moro is there to get you to oppose all directions into, but you can see this child here is just struggling with the crawl and so forth. And then when I go back, this child doesn't come to sitting through his pelvis. He doesn't, you know what I mean? And parents go, oh yeah, you're right. How did you know all this stuff? Because again, you had deviations in all your prior milestones. Why wouldn't you have deviations in this one? You can't miss movements to create movements. And so if you want more typical experience for their development, you've got to start with tummy time. And sometimes you, like, again, if your child's older, but this army crawling through, you might have to go to tummy time for just like a week. I'm not saying you've got to spend 5 months doing it, but you need that movement. But here's my bonus. Don't go into the next step when you haven't had a good foundation. Sorry. I had my car in service, so I'm watching my phone. I've had a little bit of a rough week. I apologize if I've seemed distracted this week. Don't prop the fall. Okay. Babies don't fall. Yes, Michelle, they do. Yes, if you leave them on the bed and whatever, they're going to fall. Gravity wins, no matter. But babies aren't organized to fall, right? You shouldn't. Right now too, I don't worry that I'm going to fall. I don't worry if I go down the hallway. Now, again, this same thing is just as important for your grandmother or grandfather, just as it is for your baby. When a baby is not getting the floor, when they're not getting that opposition to gravity, don't make it more complex. What is a child going to do with this physio ball? You might think it's fun. Don't prop the fall, because if that baby moves into a position from tummy time to oops, don't fall, that's what they're going to do. And that'll deviate every milestone, because they're going to learn how to prevent the fall. And so they'll avoid the fall. And that, again, same thing you see with the grandmother. If someone's fallen and broken their hip, the mortality rate within a year is what, 85%. And they just don't understand why. It's only a broken hip. No, it's this here. They will switch to learn to prevent the fall, to avoid it. Oh, I can't go to the restaurant. You know what I mean? They have trouble. Every milestone just goes And that's why too, you're learning these milestones. And another stuff too is don't prop the elbows. Makes the head way too heavy. I'll see your question. I'll get it 1 second. And makes the baby too tall and they fall out of it. And again, they will learn to prevent the fall versus creating a milestone. One of my trainings, actually, sorry, it was the ABM training. This was a big thing, is we had to work on the the floor. Now, I started my training, what was I, my 40s? So 38, 40, 42-ish, right? I did the 07, 09 training. We were all on the floor. And let me tell you, first of all, I will never train anyone on the floor. I didn't learn my best work. All my work came later on the table. Now, we were told to do a high table because then the kids stay on the table. Well, to me, every kid who sees a high table thinks doctor's office and they don't want to get on the high table. They also know, say this all the time. I didn't know it then, but so in my training, right, we were all on the floor. I did not do my best work. I really didn't. So again, we were told high table, didn't do my best work. My table is designed to go off my knees. So when I'm working, right, I'm here. Right? As you can see, my table's down here. I actually have the computer on a little high table so I can see you at this level versus looking down. So I work on a table built for me. I let my kids get on and off the table so they know, like I said, the one thing that what I teach here, if you can't get in and out of something, whether it's an emotional level, like I have to go to a funeral tomorrow. It's hard. Funerals are hard because it's not something we do that often. We don't want to say goodbye. And on top of that, it's getting in and out of the situation, right? So when you are in that situation, it is what it is, right? So when you're working to bring a child to you, you have to watch how you're propping that child, because again, to put any child that hasn't experienced at least all of their milestones and they can verbally go into talking on a physio ball, I think is ridiculous. Now, I use balls here. All of mine, first of all, are underinflated. I'm always looking for that weight transfer and that transitional skills. That's my number one. And I'm also looking not to activate muscles. So I might prop, like here. I love this ball and they're so hard to get a hold of. So so I might prop the baby. So see how underinflated that is, so they can have weight transfer, but I never have it that they can just bounce off that. That's a completely, you've got lack of fall, muscle activation, and that negates anything that I do here and teach in movement lesson. You can have access to my recordings, and yes, thank you for 20 years old on his 20th birthday, and he took his life. Worst funeral you want to go to in your life. And I'm not going to say more because I'm going to get all upset. So, anyway, when you sit here and do so much for everybody, and I've worked on him as well, I just don't understand life sometimes. So when you're working with your child, again, it's about optimal development. When you're working on your 20-year-old, it's about optimal development. And you really have to go back to those things. With this boy who passed, one of the reason I was working with him is because he's 6'4", you know what I mean? And these kiddos get such a growth spurt and nobody works for them. I mean, back then we used to play basketball and ride our bikes. I mean, you can go up and down the neighborhoods now. You don't know where the kids are at. Oh, my glasses just broke. How's that for energy? You can go up and down the neighborhood and so forth, and you don't know where the kids are at because there's no bikes out anymore. You don't see any of that stuff. They're not, they're not taking advantage. So they have these growth spurts, and you see these kids raised around their Game Boys. And again, their tummy time gets ruined at 18, at 16. And you wonder why they have these emotional problems and these movement issues. It goes on forever. It really does, folks. Learning about movement is a godsend, and I'm so grateful for it, and I can't turn it off. But yes, I love what I do, but at the same time too, it's just needed. It's needed for life and who we are, Bernie is probably approximately my age. I'm 58. I should be able to anytime lay on the floor and do tummy time. A lot of people, oh, my back, my neck, did this, all that kind of stuff. It really comes into play. And it shouldn't be, because if you lose your basic foundations, you lose your optimal life. People lose their balance, they lose their, I'm never going to have six-pack abs, and that's not my shtick, but I tell you right now, I can move and I have balance, and I'd rather have those two factors than, you know what I mean, like, optimal development to me is not being the prettiest girl on the block kind of thing. I try to take care of myself, but at the same time too. And the one thing too, that the doctor couldn't believe yesterday, I just had my labs back. My bad cholesterol is at 84. He goes, it's got to be genetics. I've never seen that before. I'm like, dude, I move. And this proves to you, I don't sit home at night and just, eat a bag of potato chips. If I go to the movies, I enjoy my popcorn and so forth like that. Like, I get it that I'm heavy, but at the same time too, like, I don't eat the way that most people would traditionally eat. And I enjoy my life, and I'm not going to pass up a good filet mignon or something, but those are the things that are important. Those are the things that need to be done. And if you don't think I don't move and practice what I preach, you know what I mean? Like, no. And so I hope you really got what you needed out of this. It will be replayed. These kind of webinars are there to be shared. We have to educate everybody. I can't go to every group out there on Facebook and say, watch this webinar. That's where you come into play. That's where you come into do that. I want you to learn what I do, because I'm not going to be here forever. I am 58. This needs to go on. You need to understand milestones. There are too many kids getting in the program. And then also there's too many kids right now showing up with rare genetics. Rare genetics is really on an increase. I have my theories on that. But again, we're here for a reason, and we're here to help everybody. But I hope you see some of the things maybe that your child is not getting, missed, whatever is your language. Now, two, you know me, if you have a question later on, put it in the group, ask away. Everyone asks about videos, but they don't ask about, hey, I was thinking about what you said the other day. What are your thoughts on this? I don't get that kind of retort with people on Facebook, which I would appreciate. And those kind of things. Those are the things that people will ping me privately. And I'm like, this is my personal Facebook page. Put it on the group, because if I'm teaching you, I want everybody to learn. If I teach for free, I want everybody to learn. If someone doesn't want that exposure, then they have to do a Zoom consultation. I'm not going to sit there and, I have that all the time. Well, we just want to talk to you and ask you a couple questions. We can set up a Zoom consultation, or put it in a group. Well, I don't want to put it in the group because I want privacy. If you want privacy, you get my time, but it's a consultation. So, and that's just the way I work. You might work differently, and that's fine too. But I love doing these webinars for a couple of reasons. It gets me to put it in writing, it gets the content out, and it gets us further down the road to helping people understand what movement is and movement development. I really hope that you see how it's the importance and what's out there. And I will always be here. By the way, too, if I don't answer your question, ask it again. I've learned, because I've traveled on the world, pragmatics are different. The way people's visualizations are different. All of that kind of thing happens for a reason. And but I'm happy to explain. And that's why I do maybe a video 5 times on tummy time, because it takes that 5th video for someone to go, oh, now I understand what she's talking about. And now that I have a half a glass, this is funny. So the group is Movement Lesson for Parents and Practitioners. That's my private Facebook group. And I can actually do that now. 1 second. I have to approve you in, just because I have to watch when people try and spam any group. I really, again, that's why I'm so involved in that. I will always I do my video reviews there for free, and as well. But the other one is the baby support program. And Erin, if you can put the link in there, for that, so people can get a hold of what's needed, to get into the support program. The support program, what it's nice is, because you just have that $20 a month, but you get that live support, but you also get every course that you can pick and choose from. And also what's nice about it, the Coming to Sitting and the Pubic Bone Strike course are in that, but they're not available as a purchase price course. All my courses are I try and keep everything as reasonably as possible because I'm here to help. And that's what's the most important thing. I can't thank you enough, guys. And thank you for learning with me, and we'll see you in a little bit. But again, any questions, just throw it on the group and we're right here. Thank you. And that's the link for the support group. But again, if you need anything from me, you know I'm there for you guys, because honestly, nobody was there for me. And this is where the Tummy Time Basic Bundle. 1 second. I really appreciate, Nikki, that you listened, you learned. Erin's getting you the Tummy Time now for that. But if you go into To Help My Baby under moveandlesson.academy, all my courses are there that you need. And they're there, but please start with the newborn movement assessment so you know where your baby's at. The breathing course is good, even though you say I don't have problems with breathing. It's a really good course too, to teach you your touch. And so she's got that on the Tummy Time. But I'm just waiting for Erin. Before I end this, because there you go. So Erin's got the Tummy Time and all that, the jump start on that for that. I can't thank you enough, guys. I'll see you in a little bit. I'll see you on Facebook. And I should have put on here, the next one too is we're doing on the parent workshop. Vision is coming up. So make sure you have your calendar. If anything, if you go right on the front page of the website, moveandlesson.academy, you'll see get the calendar for 2023. All the webinars are listed there. All the parent workshops are listed there. All the free courses are coming up. The next free course is Grabbing Your Feet. And I always have something going on. Thank you so much.